The next series of videos will deal with the lower limb. The lower limb is the last anatomical region that we need to study. So we're looking at the gluteal area here. The structures here primarily are responsible for movement of the hip joint. This large muscle, to review, is the gluteus maximus, gluteus medius, and below that is the gluteus minimus. The maximus is extensor of the hip joint, while medius and minimus, they are abductors of the hip joint. Hip abduction is very important, particularly in ambulation, so that the swing limb gets enough clearance off the ground. So you can swing it forward or move, take a forward step unimpeded, and your foot will not get caught on the ground. We have the piriformis right here, superior gluteal artery. The nerve is missing. That's the nerve is the primary nerve supplying to the gluteus medius. Inferior gluteal nerve. We have the inferior gluteal artery. Sciatic nerve, primary nerve supply of the posterior compartment of the thigh. Then we have the gemelli muscles right there, obturator internus. We have the quadratus femoris, and then we have the sacrotuberous ligament. The muscles right here, they are external rotators or lateral rotators of the hip joint. So let's move to the thigh region. The thigh is distal to the hip joint and proximal to the knee joint. Anatomically, for easier understanding of the structures at the thigh, anatomically we can subdivide that into three compartments, anterior, posterior, and the medial compartment. We can also call the anterior compartment as the extensor compartment because it contains the quadriceps group of muscles for extension of the knee joint. The medial compartment is occupied by adductor muscles of the hip, while the posterior compartment is occupied by knee flexor muscles. They also contribute to hip extension. So let's start with the anterior compartment right here. So this is the sartorius. That's the longest muscle of the body. It crosses over two joints, the hip joint and the knee joint. So the main movement or action when the muscle is contracted is it will flex the hip joint, and it also contributes to external rotation of the hip joint, and also it will contribute to flexion of the knee. Although it's found here in the anterior compartment, it is a muscle that flexes the knee. When you sit down and cross your legs, your de cuatro, we call that in the local language as de cuatro. You cross your legs, figure 4 position, or when you squat, when you squat on the floor, when you assume the lotus position in yoga, that is the squat that I'm referring to. You are actually moving the Sartorius muscle. It's the longest muscle of the body. Crosses the anterior compartment area. It forms the lateral boundary to the femoral triangle. The femoral triangle is right here. The base of the triangle is the inguinal ligament, lateral boundary. We have just identified it as the Sartorius. And then the medial boundary is the adductor longus, this muscle right here. The floor is the pectineus muscle. Now, important structures are found in the triangle. Now we have the femoral nerve, femoral artery, and the femoral vein. These structures are clearly visible, especially the artery and the vein, because a lot of connective tissue has already been taken out to expose the vessels. But when you are just in the process of dissection, after removing the skin, and by the way, a thick connective tissue structure was also removed from the thigh of our specimen here, and that is the fascia lata. The fascia lata is described as a thick connective tissue stocking, so it's supposed to surround the whole circumference of the lower limb. So what remains of the fascia lata here is just the iliotibial tract, the lateral thickening of the fascia lata right there, where the tensor fascia lata muscle is attached. So going back to the contents of the femoral triangle, we have the vessels, the artery, the vein, and also femoral lymphatic vessels and lymph nodes. So the vessels, they are surrounded by a femoral sheath. The femoral sheath is actually an extension of the transversalis fascia coming from the abdominal wall. It will surround these structures as the structures transition from its intrapelvic location going to the lower limb. The femoral nerve is outside of the femoral sheath. It is not included. Only the vessels, blood vessels and the lymphatic vessels are found inside the femoral sheath. So also, I would like to direct you to this part, the apex of the femoral triangle. It points towards the subsartorial canal. Again, the fascia lata here has been released. If the fascia lata is present, all of these structures are compressed. But with the release of the fascia lata, you can see, and you can see that the muscles have been mobilized, and it looks like they have separated from one another. But with the connective tissue in place, the apex of the femoral triangle points towards the so-called subsartorial canal, meaning it's below the Sartorius muscle, subsartorial canal, also known as the Hunter's Canal. The Hunter's Canal will contain the distal, the more distal segment of the femoral artery, plus the saphenous nerve, which comes from the femoral nerve.